This is Nurse Val. Nurse Val from the Navy.
From the Navy.
She's a badass. Oh. We don't want to say that. But she is in the Navy. So what are we doing for you today?
Today I tried Botox once before for my migraines and it worked awesome. I was getting terrible migraines.
Yes.
And with the Botox, it wore out. I had noticed 1 week, I was like, I didn't have a headache this week. And then the next week, and the next week, and then they started slowly coming back. I would say about 5 months later, I started having headaches again.
Yes, like clockwork. Like as soon as your Botox worked, your migraines went away. And this is true for all patients. So if you're suffering from migraines, it is now an FDA-approved drug for treatment of migraines. And I would say 95% effective. So that is pretty incredible, right?
It is really good.
To not have to take drugs.
Oh my gosh.
Just take a quick shot and be symptom-free. Yes. And happy and beautiful and smooth.
And smooth.
Yes. Ready?
Yep.
Okay, let's do this. Go ahead and frown like you're angry. And would you say that Botox is painful if you're a novice? If you've never done it before?
It's like getting ant bites.
Little bitty
Just
bites.
little baby bites. And then 1 minute of, oh my God, and then it's done.
It's over fast. Kind of like a brow threading. I think
Oh yeah, that
none of
hurts
us
more.
women know what waxing is like. It's not bad. This isn't bad. Frown again like you're angry. Good. And I am designing your migraine Botox to give you lift and beautification, and not a lot of doctors do that. Sadly, sometimes you'll see a neurologist who can really treat your migraines, but you get heaviness, and we don't want that. Raise your brows up high. Good. And a little quick sting. How long does Botox take to start working generally, Val?
About 7 to 10 days.
Perfect.
So about 2 weeks. Usually go back to see your doctor to see if there's any adjusting that she needs to do.
Exactly.
Or he.
And raise your brows up high as they go. And we think we have a pretty good girl gang in our office, so come visit us. If you think you're having migraines and you're tired of suffering, this is amazing. Turn to the side, go ahead and smile. Good, and then I'm going to give you some for lateral brow lift, and then we're going to actually focus on the temporalis muscle, which is, I think, where she stores a lot of stress from clenching and traffic and driving.
Because definitely not coming from work.
Definitely not.
I have
me.
the best job ever.
She's the best. Love you, Val. Aw. Go ahead and bite down on your back teeth. And then ready? This is going to help a lot. If you suffer from TMJ and you are clenching your jaw all the time, and unconsciously we do that when we concentrate, when we talk to people, that works great. Should we put some in your masseter down here for some facial slimming?
Okay, we didn't numb there, but down.
Let's do that. Paula, can you draw me up a little more with the needle? I think your Botox should be very individualized. I don't want you guys to see someone who does cookie cutter work, because you don't have a cookie cutter face or a recipe for that. It's super important to see an injector who looks at your expressions, who notices your best features, and who's going to treat the right muscle groups, because their knowledge of anatomy, very critical. Last one around the eyes, and then let's do that temple again. Bite down on your back teeth. Great. 1, 2, 3. So your Botox will usually last how long, Val?
About 4 to 6 months.
Exactly
Maybe
right.
5
4 to
months.
6 months for the average person. So if you're doing cosmetic Botox, you can expect to see us 2 to 3 times a year. And if you're doing Botox for migraines, it's the same. And it's like clockwork. People notice like exactly when their Botox wears off is exactly when their migraines return. Mm-hmm. So I think that's pretty definitive proof that it is really effective for migraines.
Yes, I definitely recommend it for people who have migraines. If they're lasting anywhere between 8 hours a day or greater than 2 weeks, your insurance can cover it.
That's right. Don't forget. It's an FDA-approved drug, so yes, we can sometimes get it authorized on your plan. Next step up is we're going to do TMJ Botox. So this muscle is the masseter, one of the most strong muscles in the body. Like the muscle forces generated here are like 200 pounds per square inch or more. So when I Botox here, it's going to do 2 things. It's going to slim her face and reduce the bulkiness here. So if you feel like you're a little square and heavy, And a lot of us get that from just chronic jaw clenching. That's gonna thin out the face and give it a beautiful oval shape. And then secondly, it's gonna help a lot with this TMJ. If you're clicking, cracking, and popping in the TMJ joint from dental grinding, it really takes these big muscle groups down a notch and makes you rest that joint, makes you not grind your teeth. And then I think it'll be good for headaches overall.
All of it.
All of it, all of the above. Okay, ready, Paula?
Smooth transition.
Yes, draw that Botox. So remember to see a provider that uses only Botox from the United States of America, from Allergan, our favorite company. Because there is a lot of actual counterfeit Botox going on. And yes, it's important that if you guys find a price that is too cheap, please, like, if something's too good to be true, it is because it is fake. It's counterfeit. There have been many instances of counterfeit Botox. Botox that comes from Canada is not FDA approved for use in America, and your health is generally not worth that compromise. Okay, ready for a little bit of improvements?
Yeah.
Yay, bite down on those back teeth. 1, 2, 3, and hold it. And this is just a quick little pinch. And 1, 2, 3, bite down hard. You're gonna look so slim for springtime. No more chubby cheeks. Bite down
My chubby
again.
cheeks.
Good, perfect. Let's do the other side. I'm gonna cross around you. Okay, how about a close-up? Right over here. And bite down on your back teeth. There you go. We can almost feel the border of the masseter muscle here. 1, 2, 3, clench. Good. And please see a qualified injector. There is so much dangerous anatomy right in here, your facial nerve, important arteries, your parotid gland. So this is not something to go and see a Medi Spa.
Definitely. We've had
right?
patients come in where they've injected their the saliva glands, so like they have dry mouth afterwards, and it's just terrible for them because then that creates
Yes.
bad breath, that creates so much decaying teeth. Like it just goes all the way downhill from there. So definitely make sure that you go see a prime doctor.
Yes. So that's it for today. If you liked our video, we hope you'll subscribe and watch us. Yay, give us a thumbs up, subscribe, leave a comment. Come visit me at Beauty by Dr. K and see me in Pasadena.